My guest today is Sherri Ozawa. She is Clinical Director of Blood Management and Bloodless Medicine at Englewood Hospital and Medical Center. And she's here today to talk about the fact that this is the 7th annual Patient Blood Management Awareness Week. Welcome.
Thank you. It's good to be here.
Thank you. I'm so glad you're here. I had never heard of Patient Blood Management Awareness Week, and who knew it's been around for 7 years.
Yeah, indeed. It's people really don't realize what patient blood management is, maybe have never even heard the term, but it really refers to all the things that we can do to make patients' blood healthier and better before hospitalization or before surgery to actually improve their outcomes.
I think for the general population, when they hear stories about blood, they automatically think it's about blood donations, places soliciting blood donations. And this is something different, obviously. And I also think that some people on their radar screen maybe is the idea of bloodless surgeries, correct?
Right. Yeah, that term's been out there for a while. And it may not be the best word, bloodless, because people think like lasers or something like that. But really what we're referring to when we say bloodless surgery is medical and surgical care without the use of blood transfusions.
And I think that a lot of people, myself included, when I first heard about that, said, wait a minute, well, how do you get around that? And why would people not want to have blood? But there are certain populations and certain religious populations where it's like prohibited, right?
Right, exactly. So for the Jehovah's Witness population, that is a Christian religious group, this is an important part of their belief system that once blood has left the body, it shouldn't come back in the body, which would be either through dietary use or in modern use in blood transfusions. They will not accept blood as part of their medical care.
Okay. So talk about now how that ties in with the whole idea of managing your blood.
Sure.
I think it's a curious name too, about blood management, patient blood management, because you don't think, oh, let me manage my blood needs.
What does that mean? It's like manage your money.
So what does that mean?
So really, Englewood Hospital Medical Center almost 2 decades ago really started an organized program to address what we talked about a moment ago, this patient population for whom blood was not an option, and primarily the Jehovah's Witness population, but others too, who really had concerns about accepting other people's blood. And so we started to use accepted, safe medical technology, pharmaceuticals, things that could improve their blood count, for example, before surgery, collect blood in surgery, recycle it and return it to patients, well accepted technology to get through these procedures without transfusion. Really, in a very short amount of time, we realized that the things we were doing for this specific population, this bloodless population, to avoid transfusions, were better medical care for everyone. So we termed that patient blood management. What do we do for all patients to make their blood better, healthier, and so they have a safer outcome in surgery or medical care? So
I guess what I'm hearing you saying is that it went from that very specific population. Now it could be for folks who are having elective surgery, right?
Right, exactly. And if you come to an institution like Englewood or others that have organized patient blood management programs, whether you personally have a concern about transfusion or not, we know that the science tells us that if we manage your blood better, both ahead of hospitalization, if we have time, if it's not an emergency, even in emergency situations, your outcome is going to be better. So there's many, many things that we do to manage your care with a focus on optimizing that health of your blood to lead to a better outcome for you. Even if you may not have a particular individual concern, we know we've done a better job.
Right. I think a lot of people, they don't want to think about it if they're having surgery. So you don't think about it in advance because, you don't really want to necessarily. Right. But it would behoove people to do just that, right?
Right. And people really ask very logical questions, right? If we're having surgery, we ask the doctor, will I survive, right? How many times have you done this procedure? Will I have a lot of pain? When can I go back to work? Those are the logical questions. And we've sort of been trained to ask those questions as a population. This is one we really encourage people to add along to it. How about blood transfusions? Do you think that will be required? And if so, what can we do to avoid that happening? Because there's a lot of good reasons to avoid transfusion.
Yeah, let me ask you this. I mean, why is this a critical issue? People may be watching and saying, I don't really have to know about this.
Yeah, absolutely. And there's a lot of aspects of transfusion that the general population really doesn't understand. People perceive it as you donate blood. It's a good thing to do. It certainly is a generous thing to do for the community. And on the other end, somebody who needs it will get it, right? And we hear about blood shortages all the time. People try to help with that. But really, there are some very pressing issues related to transfusion, not just in this country, but around the world. It's actually the most commonly performed procedure in U.S. hospitals today. But it's also been called by the American Medical Association one of the top 5 overused or wasted procedures that we do. So the estimates are that 50, 60, 70% of the time that physicians give blood, patients didn't actually need it.
Okay, so, and you could, as a patient yourself, you could play a role, I guess, in talking to your doctor, saying, well, what can we do so we can avoid that?
Exactly, and we really think that it's sort of a multi-pronged effort to help physicians. So when your physician, gives you a blood transfusion, he or she doesn't mean to do anything harmful, right? He's trying to help. But what we've really realized from the studies is that physicians have not learned enough about what blood really does. It's really a liquid organ transplant that has big implications for patients. And if we aren't sure we're really helping them, there are significant risks to transfusions. And if we're really helping a patient, those risks may be worth taking.
Right.
But if we're not sure we're really helping, and what we've learned is that doctors don't really know enough about what is actually happening when they give that blood to a patient. There certainly are patients who clinically are in the situation where they may need it. But what about all the other patients that probably don't, yet we give it to them? We've given them only risk, and we've given it to them at great cost. It's extremely expensive also to administer blood.
Wow, very, very eye-opening. I thank you so much for coming by to talk about this. What can people do if they want to learn more, or is there somewhere they can read up?
Sure, there's a couple websites that would be helpful. One is englewoodhospital.com. There's a lot of information on patient blood management, and there's also a nonprofit educational organization that we've created called the Society for the Advancement of Blood Management. The website is SABM.org. There's plenty of information for the public there as well.
We'll give them a little homework to do. Very good. Thank you so much, Sherri Ozawa. She is Clinical Director of Patient Blood Management and Bloodless Medicine at Englewood Hospital and Medical Center. Thank you so much. I feel like I got a big education in a small amount of time. I thank you.
My pleasure. Thank you for having me.
You're quite welcome.